good place to start is just setting the foundation is really defining what ADHD means. People have different definitions and there's different versions of it as well. But let's start there. Like, what is ADHD? What does that exactly mean?
So I'll start with, we have an official diagnostic criteria from the DSM, the Diagnostic and Statistical Manual, and that's been the established definition for decades. I mean, it gets changed a little bit, and it's what all our research studies are based on. People have to meet these criteria, but the criteria are not perfect, as they aren't for any of our mental health conditions. But the DSM criteria say that ADHD, there are 9 inattentive symptoms, there are 9 impulsive hyperactive symptoms. So hyperactive impulsive would be getting up and walking around when it's inappropriate. It would be fidgeting or moving unnecessarily. It would be blurting out answers or interrupting people. Inattentive things would be being distracted by inappropriate stimuli, being unable to sustain work on a task, being reluctant to start a task that takes excessive effort or mental concentration, making careless mistakes because you're not paying attention. So for an adult, and I'm going to focus on adults because that's what I've worked with. So ADHD was a diagnosis that was first established in children. And when I was in training in the 90s, the dogma was that adults didn't have ADHD, that every kid who had it outgrew it. We know that isn't true. But jumping back to the definition. So the definition for an adult right now is that you need to have at least 5 of these symptoms. And since these symptoms are behaviors that everyone does at least occasionally, what's important is that these are done excessively, and they're having some negative impact either on functioning or on personal well-being or distress. So distress and dysfunction from excessive manifestation of these symptoms in at least 2 different settings. So if it's just happening in the school or just happening with the boss you really hate, then it's probably not ADHD. And these the criteria for whether they're excessive are compared to your own age group and your cultural background. So what's appropriate for a 5-year-old is certainly going to be different than what's appropriate for an 8-year-old or appropriate for the president of the United States. So
Got it.
so some people criticize many of our other mental health conditions like schizophrenia, has hallucinations, has delusions, which normal people in everyday life aren't having. And one of the challenges facing ADHD is that every single symptom is something that normal people do at least occasionally, and they don't have, the fancy term is a pathognomonic. So that's a single symptom that's characteristic of that disease or condition and isn't indicative of anything else. There's nothing, there's no one thing you can say, I have that, and therefore that means I have ADHD. So that's made it, many critics have attacked it. On the other hand, compared to all our other mental health conditions, which all of the others require knowing something about what's going on inside the head of someone. You need to know how they're feeling. You need to know their motivation for certain behaviors. ADHD is written purely in terms of the observable behaviors. So in some sense, it's actually the most objective of our mental health conditions. And I'm not saying that in real clinical practice, it's always completely that we're removed from all subjectivity, but at least as it's written, it is the most objective one. Now, the criteria were developed in kids. They were modified a little bit because, again, kids literally do run around in circles in the classroom. We've all seen it. Most adults, even if they have severe ADHD, aren't running around in circles. So some, particularly of the behavioral symptoms, have been modified and rewritten slightly so that they can fit an adult profile. But one of the things, some of the prominent symptoms or factors of ADHD, like poor time management. So not just being late for appointments and missing things on your schedule, but if you put people in isolation, just ask them 37 seconds later, how much time do you think has elapsed? Most people have a pretty good estimate. People with ADHD are actually consistently off, and they're consistently inconsistent. It's not that they're always underestimating or overestimating, but something about their internal time sense, not just whether they're being distracted and that's pulling them off their calendar, is off. But there's no measure, there's no symptom for time management explicitly in the DSM. And one of the other big dimensions that people have noticed is that a majority of people, this isn't everyone, but a majority of people with ADHD also have issues with emotional regulation. And there's not a single mention that ADHD was very sort of narrowly putting people in a box regarding sort of cognitive, academic, maybe work performance rather than the whole social realm. And this is something that has impact at least as big in the social realm
Mm.
as academic or work success.
Yeah.
So,
The
so,
question that I
so I was
had
going to
though, yeah, go ahead.
so getting back to the definition. So we have an official, formal how it's diagnosed, but more, I'd say most of the research field and many of the patient groups also are more focused at of viewing ADHD as a problem with executive functions. So those are the brain systems that are regulating our thoughts. So resisting impulses when they're inappropriate, helping us plan, helping us organize, helping us direct attention. And that most of that seems to be contained or controlled by prefrontal cortical circuitry, and particularly dopamine, glutamate, norepinephrine are neurotransmitters that seem intimately connected with ADHD.
Mm. So when doctors or clinicians are actually diagnosing adults or children, are they looking at the prefrontal cortex to actually have numerical or visual quantifiable measurements to determine whether someone is maybe less activated in the prefrontal cortex and therefore because they have ADHD? Because it seems the other factors are a little bit subjective, right? You mentioned kids versus adults. Kids are obviously just going to be the ones likely to run around, and so are other kids. And so if one of the criteria is how do you compare yourself to other people in your similar age group, it's not really going to be as high of a delta of the differences in behavior for children. So children, you might
Well,
have a
but
harder time diagnosing.
yeah,
My
I'll
assumption.
push back a little there. I mean, things like how often do you interrupt people? So, I mean, that can be something quantitatively measured and varied, and we can have standards for the general population. You can even have it for politicians. We know certain people, when Trump was debating Hillary 12 years ago or in the Republican primary, he clearly measurably interrupted people way more than even other politicians. So again, all of these behavioral symptoms are measurable, whether we actually do or not, or we often rely on a clinician's assessment of whether that's successful, or the teacher's assessment, or the parent's assessment of whether that's, this kid is doing it way more than other kids his age. But getting back to the biological part, so we have literally tens of thousands of research studies, many of them brain oriented, neuroscience oriented. And in general, what we find is that although on many variables we can find group differences for dopamine receptors or for brain activity and that's during a certain task, in every situation so far, the range of values for the normal group overlaps with the range for the ADHD group. So you can't use, if there's overlap, we can say, yes, on average, people with ADHD measurably have brains that are different. But the overlap is so great. It's sort of like we know, men and women are different sizes. Um, Men are taller than women. Does that mean every man is tall? Can you use someone's height? If I tell you someone's 6'2", your suspicion is that that's going to be a man. But if it's a women's basketball player in the WNBA, then the height is not going to give. So we don't have any biological markers because we don't have completely discrete, non-overlapping categories. And the interesting thing is that's not only true for purely biological markers like dopamine receptor density, or I'll get to genes in a minute, or brain activation from EEG in a certain level, or blood levels of serotonin or dopamine or something like that. but even executive function tests. So we define ADHD, or we're thinking of it conceptually as executive function deficits, but even executive function testing, where we can measure someone's, how good is their working memory? How good is their impulse control? Even on those tests, there is significant overlap between the general population. So again, in general, people with ADHD have deficits or perform worse on those standard tests. And part of that is the group overlap. Part of that is also that the testing situations, the psychologists who define those tests or come up with those tests are trying to measure just, what is working memory and not affected by motivation and 17 other factors that might be going on. So the testing situations, they always try to remove distractions. They always try to provide clear, explicit directions. They always ascertain, do you understand the directions before we go first? So they're actually correcting for a lot of the ADD behavior, and then they're going to test to see whether your behavior on this test reflects ADHD. It doesn't make sense because you've actually canceled out some of the executive function deficits that are showing up in the real world, where someone isn't paying attention to their instructions when the teacher says what the homework assignment is, or they're distracted by 42 things in the classroom. Um,
Yeah, and I read somewhere that the rise of ADHD in the last 8 years has grown by something close to like 40%. I think the stat last was like 2020, so that might be a little bit different now. But when you're talking about the diagnosis of these of ADHD and how people are actually measuring it, like, well, what do you think is the root reason why there's been such a rise of ADHD? And are you familiar with whether children ADHD have been rise further than adult ADHD? I'm sure you know the stats better than I do.
yeah, I mean, one is that some of the statistics come from comparing very different assessment measures. So you're sort of mixing apples and oranges, but there are certainly some systems, including the US government and CDC, sends out annual surveys, or we can look at prescriptions for stimulant medications, you looking at the same population year after year, and there are clearly differences. The huge increase in diagnoses has actually occurred in groups that we know are underdiagnosed before. So it's in women, it's in adults, it's in racial minoritized groups that have been traditionally under-recognized. And the rates in kids actually have been fairly stable. During COVID, there was some increase. And I'll sort of jump into that. So one of the things we know is that many of our mental health conditions, including ADHD, have a strong genetic component. And strong means that the heritability is around zero point 0.7, zero point 0.8. Heritability isn't exactly what percentage of it is due to genes, but for the sake of simplicity, we'll just say it's close to that. So the majority of the likelihood you develop ADHD is in your genes, but just as with everything in mental health or human behavior more broadly, it's always nature and nurture. Your brain, your brain is a product of your genes and other biological influences, and also the social, cultural, personal influences. So we've known always that although genes are important, that other environmental factors contribute as well. So getting back to the intro, I mean, with ADHD, getting back to some of what you were saying before, sort of trying to find a biological marker, since the symptoms, let's say, are so commonplace and not unique. Many of the both researchers and patient groups with ADHD have sort of really clung to there's a big genetic effect, this is biological, this is real, and they've sort of, even though the basic science researchers have been aware there's factors other than genes, we've sort of clung to the biological identity or core to justify its existence. And one of the really interesting things to me, and I haven't seen anyone else talking about this, in the very early days of the COVID pandemic, mental health professionals, public health officials got on the media and say, if we're going to have lockdowns, if we're going to have a pandemic that's affecting lots of people, we're going to see increases in depression. We're going to see increases in anxiety. We're going to see increases in substance abuse. we're going to see increases in PTSD and domestic violence. They also predicted increases in suicide, which didn't happen. Not a single person I heard predicted an increase in ADHD. And yet, ADHD is one of the conditions that increased more substantially or dramatically during that time. And I would argue it was completely predictable because, again, yes, there's a genetic predisposition or propensity towards it, but the pandemic was ideal situation environmentally to push people more in an ADHD direction. By that, I mean, we know that people with ADHD depend highly on their external structure because that's part of what is with weak executive functions they can't create for themselves. They're not creating a schedule, they're not sticking to the schedule. And when people are suddenly removed from the workplace and they're working at home, and they're also surrounded by way more distractions in their home environment than they were in the workplace. And Joe and Beth and Mary weren't all going to lunch at 12 o'clock and, hey, come along with us. So people are missing lunch, they're missing assignments, they're out of track. ADHD symptoms we should have been able to predict were exacerbated by the pandemic, and more so I'll get to a big point I haven't made yet, which is that ADHD exists on a spectrum. So people who are sort of on the borderline of the diagnosis, more of them are being pushed over into full-blown ADHD. And again, that doesn't refute that there's a biological core to it or propensity to it, but it's acknowledging that again, all behavior is an interaction between the basic biology of our brain and the environment we're working in. So I wanted to jump back to the spectrum concept. So our DSM criteria makes it categorical. You either have those 5 symptoms that are causing impairment or causing distress in multiple situations, and they're either inattentive or hyperactive, or you don't have it. And yet, what if you have 4 symptoms and one of them is really bad? Or what if you have 7 symptoms, but none of them really meet full criteria for distressing in themselves? So the researchers have known for a long time that there is a spectrum. Some people call it subthreshold or subclinical ADHD. And again, officially, those people didn't have the diagnosis. But one of the things, and Margaret Sibley and other researchers have been shedding light on in the last few years. So our old conception when I was in training is kids have it and they all outgrew it. How did we abandon that? And part of that was the idea that the thinking behind that comes from how siloed the medical world is. If you have ADHD as a kid, who are you treated by? Most of them were treated by pediatricians, a few by child psychiatrists. What happens when you turn 17, 18, 19, go off to college or stay in your own community and just grow up? You're not seen by your pediatrician anymore. You're seen by a new doctor who's a family practice doctor, a generalist. They don't know anything about ADHD. They don't even think it exists. So why? So if you're displaying some symptoms, they may attribute it to moral, you're lazy, you're crazy, you're stupid, you're just delaying. Or if they think there's a condition, they'd more likely attribute it to depression, anxiety, something that they knew and were familiar with. So we started becoming more aware of ADHD continuing into adulthood in the 90s. And part of it was ADHD clinics were being established for kids. And clinicians were noticing, wait a minute, how come the we have a depression clinic, we have an ADHD clinic, we have an anxiety clinic, but it's the parents for the ADHD clinic who are showing up late, who are forgetting to fulfill their kids' prescriptions, who are displaying all these inattentive or hyperactive traits themselves. And again, the research showing that there's a strong genetic contribution, it made sense. These things are running in families. And so we became more aware that it does exist in adults, although again, the awareness of that, when I speak at senior centers and in the Bay Area where I lived for years, the senior centers I spoke at were a highly educated, well-off financially, a very sophisticated audience. And invariably, even in the last few years, 70s, 80-year-olds, the idea, they have some vague awareness of ADHD, but absolutely none that it could occur in adults. So there's sort of been a cohort effect. So, anyone, any medical professional trained before my time, or even specifically psychiatric, there was no mention of ADHD in adulthood because it didn't exist theoretically.
Right.
Um,
So unless you were
so
diagnosed as a kid, the chances of you getting diagnosed as an adult is a lot less common because of the lack of training and the lack of information that happens within normal practicing family doctors.
yeah, well, and even among psychiatry. So when again, and that's improved over the decades. But when I got started in working with adults with ADHD in the '90s, very frequently I would see individuals who were in their 40s, 50s, 60s who had been on disability for mental health conditions for decades, and the psychiatrist, or their depression just isn't responding to anything, their anxiety isn't responding to anything, their bipolar disorder doesn't seem to respond.
I just mentioning that it's easy, it's less common for adults to be diagnosed unless you were diagnosed as a child.
Yep. So I was talking about um, many individuals, and what I was expounding on, it wasn't just family practice doctors or general medical practice, even psychiatrists would miss it. And I saw numerous people, and I still do to this day, who have been on disability. That means they were deemed so unable to function in regular life that they're getting government payment for it, um, and for mental health reasons. And they were told for years, you have depression, you have anxiety, you have bipolar disorder, and the doctors, the psychiatrists would be treating the person for, and they're not responding to our traditional medications, and the person would have ADHD as their actual complaint or problem, sometimes complicated by these other conditions. That was completely missed because the doctors weren't looking for it or were locked in. This is a depression patient. Again, that's hopefully becoming less common, but it still is occurring.
Just to pin the needle on the genetic factor versus environmental factors, I guess people have kind of told this story, it seems, that because of the distractions we're getting with technology and smartphones and all the notifications we get from social media, that most people seem to have these characteristics of feeling like they have ADHD because of the normal environments that we're currently living in, the modern technology environment. Is it true that like that factor from using smartphones and technology is potentially causing a rise in children and also adults in terms of ADHD?
So my answer would be emphatically yes, and most of the field would say emphatically no. So again, along the lines of this categorical model that you have ADHD or don't, forced by DSM. While there's been acknowledgement that it's a spectrum, again, and there's been big pushback both by ADHD patient groups and doctors that we don't want to be confusing this with everyday distractibility, everyday failure to concentrate, everyday impulsiveness to click on this or jump to that because we've been trained to do that. I think we're going to need to change our models and incorporate things. I think our whole diagnostic system needs to be changed mental health wise. But all the evidence we're accruing shows that it's the same executive functions, the same prefrontal cortex, it's the same failures that are going on. So jumping back to the spectrum issue, my conceptualization is that there are people who are sub-threshold, and maybe if they were living in 1980s America, or year zero farming community, somewhere in the Middle East or somewhere else, they would not have ADHD. But with our current stimuli clearly pushing people, drowning them in more, it's not just the volume of information, it's also the demand to respond quickly. It's the demand to respond without, actually, it's reinforcing impulsivity. It's breaking up the ability to have any time free of concentration or free of interruptions in your concentration. So people are responding quicker. They do have shorter reaction times. These are measurable variables. I think when you apply pressure like that society wide, if you have a condition that's on a spectrum, you are going to be moving sizable numbers of people who are in the past would have been sub-threshold into full-blown ADHD. That isn't a view that's been widely endorsed. And again, part of it is we have this identity as ADHD researchers and identity as people with ADHD, and this is a serious condition, and we don't want it to be confused with everyday silliness.
Yeah, the interesting thing about this is that because everybody else is also distracted, the one you mentioned one of the factors is how you compare to the other age groups. The reality is like everybody else is also distracted. So even though if you were to compare yourself to someone in 1980s, just that alone, you're probably a lot more distracted because of the access to modern technology, because everybody else in your age group also is distracted from countless distractions and notifications. It's not like you're that much different compared to the other people in your age group.
Yeah, so the norm is shifting. On the other hand, it also cuts another way in that even, I'm someone who only has one phone. I don't have a phone for work. I don't carry my phone with me. I know I'm an anomaly or a Luddite or something. But even if I'm not engaged in checking my messages 42 times a day or distracted, and the studies have shown that even having your phone turned off, but just its appearance near you visually makes you more distracted. Even if that isn't directly affecting me, I'm interacting with individuals who have all shifted further along, who are all interrupting each other or talking only in brief sense or trying to do something on their phone while they're having a one-on-one conversation. So even if you yourself are trying to remove yourself or taking a tech vacation or doing something, you're still subjected and immersed to our whole society that is moving more ADHD words. So I've labeled it in the book I wrote 6 years ago that we're engaged in a vast biopsychosocial experiment that none of us have given informed consent to, and none of us are really paying attention to, which is part of the problem, that we're not paying attention because we have to respond to each new stimulus, new request for wants, likes. Just, I, I was also thinking it's worth jumping back to the genetics component. So there was an idea, and it had pretty widespread interest in the 90s, maybe even the first years of this century, that we would find a specific gene, gene for dopamine receptors or something like that, that would explain the genetic contribution. And the more that we've looked at the genetics for almost all other health conditions and for ADHD, genetic contribution isn't just one or two genes. It's which variety on several hundred, if not maybe even 1,000 or more genes you get that increases your predisposition. And many of those, tiny, tiny effects are common to all mental health conditions. So it's not that the same genetic profile leads to ADHD or leads to depression or schizophrenia, but that there's really marked overlap between genetic propensities. And that's part of why many people, if you have one mental health condition, that's more likely than not that you meet criteria for another condition. And some of that gets back to the whole problematic, are these meaningful categories if one person tends to have more than one? And if you have two or three, then again, you're more likely to have three or four or five of them. So, so there's a couple of different problems or flaws with that. And one approach to try to get around some of this is the DSM had for years had most of the criteria for any condition, or most of the conditions had a criteria of a rule out condition. So if all these symptoms you're having could be ADHD, but we know, depression can make you inattentive. Depression can interfere with concentration. Depression can decrease motivation. Depression can have a lot of the same executive function deficits. But if it's coming from depression, then it's depression, not ADHD. So we have our whole system is based on ruling out, ruling out, ruling out. And I think that's useful and valid in lots of ways. I think it's really important. I've seen people who died because they were misidentified with bipolar disorder rather than ADHD. I can get into that
Yeah.
if you want. So I
Yeah,
do
that's
think
common here.
diagnosis is important, but I do think our whole rule out system is problematic. And I think we're going to have to move to the exact opposite, which is a sort of a yes and that, that we're going to identify clusters of, let's just call it a prefrontal executive function core. And that's what we're currently calling ADHD, but we know in schizophrenia, many people have that core. We know that in depression, many people also display that. We know that in complex PTSD, many people display that. Um, but but there are other cores to what's going on. So with schizophrenia, they're also having delusions and psychosis. And PTSD, they're having a specific traumatic memory or situation which triggering things.
Yeah, you mentioned the heritability factor is very high correlation, zero point 0.7, zero point 0.8. But I'm curious to know if you've seen cases or how common it is where an early childhood experience that someone has had leads to ADHD. So someone may not have had ADHD as a child, but because of experiences they've had as children, it leads to exhibiting factors and characteristics of ADHD as they become adults. Like one of the big things that Dr. Gaber Mate talks about is that ADHD is response to stress. And the essence of ADHD is not a lack of attention, but a lack of self-regulation. A lot of the love and affirmation that was supposed to be provided as children, when that's missing, then it leads to a lack of development in the prefrontal cortex. And because of that, it leads to exhibiting these factors as an adult. Have you looked into kind of research
Yeah,
around this?
there's a lot of so I don't know Gabor Mate. I believe he's well intentioned. He writes particularly evocatively, and people resonate with his thoughts. I'll point out that he does not have training as a psychiatrist or mental health. He's a general practitioner with some cardiology expertise. And I think what he's touched on is that one of the conditions most difficult to distinguish from ADHD is complex PTSD, that there is a lot of overlap in defective, as it were, prefrontal cortex control regulation systems. On the other hand, in much of his writing and many of the people who follow him, and a large component of what I call the trauma industry, which has really taken off in the last 20 years, attributes all of ADHD to complex PTSD, and that is flat out verifiably wrong. I mean, one aspect is the genetics. If genes contribute to ADHD, then that's saying the environmental role can't be all important or the biggest single again, for an individual, it might be, but it can't explain all of our cases of ADHD. There's no possible way that can work mathematically. Two, very careful, very in-depth surveys, or not just surveys, but exploration with individual patients shows that a number of patients with classic pure ADHD don't have any history of trauma. So again, at least in some individuals, this cannot be the explanation. Three, and this is one of the weirdest things, evidence or most unknown things, there's massive evidence that rates of violent interpersonal interactions have decreased markedly in the US, like 60, 70, 80%. That's well established associate, but it's hardly known. So, and most studies would suggest even minor, or I shouldn't say minor, smaller, lesser degree instances of abuse, neglect, mistreatment of kids usually track pretty well. You know, if you're decreasing the major events, you're almost certainly have also decreased minor events. And how do you explain an increase in ADHD if it's all coming from trauma with decrease in trauma, a pretty massive decrease in trauma? It doesn't fit. So again, I'm not saying that some individuals don't have prefrontal cortex executive function deficits coming from their trauma. And clinically, it is probably the most difficult condition to sort out. So some other factors that make it even harder to sort out is we know that one of the best documented So I've talked about ADHD being serious, and some of the best evidence that this isn't just, again, oh, someone's late for something, or someone's interrupting, or they're the clown, or they're the ditz, or there's a squirrel. It's not just silly distractedness. ADHD has a major impact on shortening lives, and has a major impact on contributing to accidents, from car accidents to ER events for falling down, breaking bones, all sorts of things. So kids with ADHD and adults with ADHD have trauma at more than double the rates of the general population. So physical trauma, and there's evidence that they're more likely to enter into bad relationships. So domestic violence, family trauma is higher if you have ADHD. So ADHD itself predisposes you just for traumatic events. Two, there's even data that suggests, even given equivalent amounts of traumatic exposure, and that's a little bit hard to do, but researchers can do it, people who have pre-existing ADHD are actually more likely to suffer PTSD symptoms after their trauma. So there's something, again, presumably with how the prefrontal cortex and regulation of amygdala and basic emotional circuitry is maybe less tightly regulated or care. So these kids are vulnerable both because of their own actions and because of their brains are more vulnerable to have a PTSD-like response when they are traumatized.
Yeah, interesting. I mean, the negative correlation between the traumas and the domestic abuse, um, and the rise, even if it's a flat ADHD levels within the US, certainly would debunk that. So that makes sense. Um, Right. Now, skipping over
And,
to,
and I'll just go into more clinical. I mean, this might seem sort of like an intellectual exercise. Who cares whether your trauma came or whether your dysfunction came from the. But I've seen it be really screwing people up, and that's not a technical term. But a couple of years ago, a decade or so ago, a woman referred to me. She had worked with a skilled psychotherapist for more than a decade. This was a psychiatrist, so had medical background as well as, and they were focusing on why the woman was self-sabotaging. And that's how they defined her problems, because she was late picking up her kids from school. She was late getting in her assignments at work. She was interrupting people and speaking out in the group meetings when it was clearly across the line. And so a whole range of inappropriate behavior, a whole range of inattentive behavior. And for a decade, they had not found the underlying psychological reason why this woman was self-sabotaging. And she was referred to me at a point when there was some depression added on top of what was going on. And we reviewed the symptoms, and it was clear she had way more than 5 full-blown symptoms of ADHD. She met the full criteria. We could track it back to childhood that these symptoms had been going on. She intellectually understood, and that's a very different conception. If you're blurting things out in the meeting and you think, I did it because I have some hidden desire to embarrass myself or destroy my career or ruin myself, then I did it because my brain has greater difficulty inhibiting my behavior. It doesn't excuse it. But and she was so bonded to this therapist and bonded to this view of herself that after 3 or 4 sessions, she did not follow up or we treated the depression that was going on, but didn't opt for any treatment of ADHD. And I can't believe that her life trajectory, I don't think, has improved if with another 5 years of searching for why she was self-sabotaging. So misdiagnosing and missing, part of it is ADHD is a highly treatable condition. That doesn't mean we eradicate all symptoms, but for most people with ADHD, medications very quickly can move someone into a realm where they are functioning better, that they're completing tasks with their.
what happens when over time a patient like that who probably has ADHD is just left undiagnosed, is left untreated? What happens after 5 years, 10 years, 20 years over time?
I mean, in general, their conditions, I mean, they keep getting into problems and they keep failing in achieving what they want. And again, death rates are measurably higher. So it's that the premature death rate or years of life expectancy loss for kids diagnosed with ADHD, males lose about 7 years, females almost 9 years. That's comparable to a diagnosis of diabetes or major depressive diagnosis, which has high suicide rate. So they're dying earlier, but in other realms of life, if you have untreated ADHD, income is lower, educational attainment is lower, marriage satisfaction, you're more likely to be divorced, you're more likely to have never been married, you're more likely to have unhappy relationships. So it has impacts all across life, which is why, again, the ADHD groups are sort of defensive. This is an important, serious diagnostic category. Don't trivialize with you forgot where you parked your car or you can't remember what point you were going to make in the conversation because 17 other things came up.
And does the severity of it continue to increase if it's left undiagnosed?
So again, work by Margaret's. The thought for a while was again maybe so. So when I started, it was all kids outgrow it, and then it shifted to, and different people have different numbers. I like to simplify things. For a while, then it was sort of thirds. Maybe a third of kids outgrow it. Maybe a third don't get any worse, and the middle third gets somewhat better, but there's still some residual symptoms. And the claim or thought was that, the degree of severity you have by young adulthood is probably stable. But again, what we're appreciating more is the interaction between your brain and the environment. So we've known for years that when do people show up for treatment for ADHD? One is a big chunk do show up in childhood because they're either so disruptive in the classroom that the teachers demand this kid needs to get evaluated, or the parents are so concerned that this little Johnny's not going to get into Stanford or whatever it is. They better start buckling down. But there's a large number of kids who either had, intelligence or other strengths who don't manifest and who had a bunch of ADHD symptoms who don't show up for treatment until high school when the demands are, you need to buckle down, you really need to turn in your homework, you really need to do X, Y, and Z, and two other transition points that get lots of attention. Or I've had kids who, did well enough in school to get into Stanford, one of the most exclusive, clearly a bright kid, and then was failing out the first year. And what was going on? The kid had pretty significant ADHD. Why hadn't it shown up or caused a problem? Well, in his family, mom and auntie would sit with him every day after school till his homework was done. They weren't doing it for him. He did it himself. He had a good brain, but they provided the structure, the framework, the executive functions to take care of that and get it done. And at college, hey, parties, girls, drink, whatever. He wasn't stupider, but he didn't have that structure to keep him on track. And it really blew up and he came close to failing out. So again, increased demands and decreased structure are recipes for exacerbation of ADHD symptoms or the same symptoms causing more problems. So second transition after, high school is one, college is another big one. The work world is a huge one. So in this day and age, lots of colleges have special centers to help students with these. Lots of professors are willing to offer accommodations that, you can have a note taker, you can take this test in this special environment. You get to the workplace, Google's not going to offer that. Hertz Rental Agency isn't going to give you special dispensing. I mean, they are required to give accommodations, but we can get into that. So many people show up for evaluation of ADHD, and we've known this again for years, that this is common. Again, it wasn't that their ADHD suddenly appeared at this age, it's that their interaction of their ADHD brain and their environment suddenly resulted in this isn't functioning or working well. The final transition, and I guess final transition is death. The penultimate transition is retirement. And this is a widely unstudied area, but there's a little anecdotal and other evidence that that's another, why would that one cause stress or difficulty for an ADHD brain? Now, the demands are lower, but the structure is way lower. So there's people who found a career that worked for them. They were interested in it. They could navigate it. But they knew, their boss each week or each month or each day was telling them what to do. They're relieved of that. And what do I do with my time? I could do this or this or this or this or this. Or so I'll annoy the wife with 400 questions of what I could be doing, or I'll put around. So surprisingly to many, retirement is actually a time where people who had found a way to accommodate their ADHD prior to that suddenly can't. So there's a phrase in the ADHD community that normal brains are importance driven, and ADHD brains are interest driven. And it seems simplistic, but it actually captures a lot of what's going on. That if you know your taxes have to be paid, who likes paying tax? I mean, there's a few obsessive people who like going through that or sorting through or reviewing their year. Most people hate it. Or Tuesday, you have to move your car, it gets towed, or you get a ticket. Most people know that, accept it. They don't, it's not the highlight of their week. I'm going to go out and move the car. People with ADHD understand those things are important, but hey, let's see what's going on in the NBA playoffs. Oh, look at this cat video. Oh, let's hear the 14 different inane things the president just uttered. They're
Right.
driven by their interest and they know what they should be doing, but it's much harder for them to attend to that. And that's what gets them into trouble.
Yeah, it's almost the routines and the confinements of their workplace or their professional lives or their home place probably hide some of the characteristics of
Yeah.
ADHD that comes
Yeah.
out.
So if their task was interesting enough to them, if their work was compelling, then they can be. So the other thing I haven't mentioned this far, and it gets in with the executive functions, ADHD isn't a deficit of attention. It doesn't mean that you can't pay attention anywhere. If there's a deficit anywhere, it's in the control of attention. So there's less ability to direct it to what's important and to avoid it for what's not important. There's less ability to sustain it when you want it. And there's less ability to redirect it when it's time to, okay, I've spent an hour researching this project. I have to write it up the next hour. I can't spend 3 more hours doing extensive, rabbit hole Google searches. I need to stop. But they have less. So one common, so again, in the older days, we used to say ADHD isn't a problem of, it's not an attention deficit, it's a deficit of the control of attention. But that concept is still hasn't penetrated to lots of the people writing about attention problems or complaining about the authors who are writing about contention. So they will cite, yes, people are distracted, people are doing this or that, but at the same time, they can go into a, again, 6-hour in-depth pursuit of X, Y, or Z, or play a video game for 17 hours without getting up to go to the bathroom. And they'll cite that as, see, people can sustain attention. But if you talk to those people, most of the time, even if they enjoyed in the moment, if they were sort of being interest driven rather than importance driven, they'll say, no, that was a waste of time. No, I really should have stopped after 2 hours and moved out. So it's actually reflecting the same deficits in the control of attention. I mean, it's the other side of the coin, but it's not a sign of healthiness and that attention and sustained concentration are wonderful in America right now. They're two sides of dysregulation and poor control of attention that our society is continuing to foster and reinforce.
Would you say that someone that has ADHD could have the tendency to be hyper focused then, if you're looking at it from
Yeah,
a positive
so
angle?
that, and again, getting back to the DSM criteria, that's nowhere in there, but it's a very common. Not everyone describes it, but it's a state of getting so locked in that you're oblivious to what's going on around you. And again, if you're an NBA player and locked in on your game and in the flow, so I think the research strongly supports that the concept of flow, and I'm forgetting to check. Um, Psychologist, and he has a long, complicated name that I'd butcher anyway, that really worked on flow. There's a huge overlap between flow and hyperfocus. And again,
Is that
it's
like Mikhail,
yeah,
some Russian name, right? Yeah.
yeah, it's Czech. It's Czech,
We won't
hopefully,
bother.
yeah.
Um,
So it's a excessive focus. I mean, the internal experience is that I'm locked on what's going on. I'm completely impervious to what's going on around me. I have loss of time perception. The situations that arise in are usually one that I'm well trained for to begin with. So it's not just walking down the beach and hyper focus on studying fossils when I didn't know anything about them before. Um, And it's usually in a situation that's challenging. So it's not, that there's some effort that initially they have to put into it, but then they are going with it. But again, part of it is when you're in that, there's not awareness that you're in it really, and there's less ability to stop it if it's inappropriate to keep going with it.
Yeah, because I wanted to shift perhaps to the superpowers of having ADHD. In the entrepreneurship community, it's often touted that there's a lot of successful entrepreneurs, and some would say there's this correlation between people that are very successful in entrepreneurship to ADHD. You have Richard Branson, I think there Barbara Corcoran, who's one of the Shark Tank members, and various others that talk about their ADHD and how it's actually helped them. One of the characteristics, or some of the characteristics, is the hyperfocus that you mentioned. It's risk taking, the propensity to take action, non-linear thinking as well. Like sometimes just being able to think outside of the box and have high energy to execute on that when needed. Even delegating because of the fact that you can't focus. Like talk to me about that. Like the fact that some people can have ADHD and have a condition that is probably seen as a negative light, but some others, like entrepreneurs that are very successful, can use that and channel that into creating massive value for the world.
Yeah, so we'll back up a little bit in terms of I've been careful. I mean, officially, ADHD is a disease. It's in the DSM, which is the compendium of mental health diseases. But I use the term condition because I think it's both more accurate and less pejorative. Um, and I think the term neurodiversity, I mean, I think it's a really powerful concept. It's saying that some people's brains are wired differently, and that gives them both different challenges and different advantages or opportunities in the right social situation. Um, so all the things you identified, hyperfocus, the some term clearly risk taking is inherently, risk taking and impulsivity are the same. They're not weighing the long term consequences or minimizing what other normal brains would say are too dangerous consequences to move forward. High energy is often associated with ADHD, and that would clearly correlate with hyperactivity. A really interesting aspect is that many people with ADHD who look from the outside to be bouncing all over and really high energy feel themselves to be low energy or low, or that they crash as soon as the exciting situation is gone, and that people aren't seeing that crash. But troubles with energy regulation are there. And again, in the public view, it can look like only the high energy part. Um, you didn't quite touch on creativity, and that's one that's a little harder to study or measure, but I mean, clearly it's associated with nonlinear thinking. Are you likely to come up with unusual situations? And there's a tiny bit of research that does suggest that unusual solutions to problems are more common among those with ADHD. Um, so there certainly can be advantages in the right context or social situation. And if I'm getting a direction you don't want me to go. So my first book, the only book I've published so far other than my PhD thesis, was called Recognizing Adult ADHD, What Donald Trump Can Teach Us About Attention Deficit Hyperactivity Disorder, because objectively, there's no arguing that he meets something like 12 of the 18, or at least 13 of the 18, and probably all 18 of the 18 criteria excessively by objective measurements in multiple situations. But it's also ADHD has led to his success. He thinks outside the box. He's willing, his very knack for spewing out what's ever at the top of his mind, he translated into a political ability. I mean, the term gaffe prone, which is applied to him and other politicians who have had ADHD, has usually been a decrement to success. If you're making mistakes, if you're saying stupid things or falsifiable things, he's flipped it on its head and turned it into I am a truth teller. I'm not hiding what I'm really truly thinking. I'm showing it like it is. I'm here exploring the line between what's candor and what's honesty. So being candid is just saying what you're thinking. Being honest is saying the truth. there's dramatic differences, but lots of his followers, he calls it like it is. He just says what he's feeling. And that's a big part of why, one, some of the things he tells that aren't true that are listed as falsehoods get listed. I don't think they're intentional lies. Talking about injecting bleach under your skin or exposure to UV lights if you have COVID. He wasn't telling his followers to go out and do that. He was just riffing off the top of his mind about what could work. Now, in a normal situation, we wouldn't have a president who just talks like that. They would be more restrained. But his ADHD-ness led him to, and again, it's worked well for him. And even the overall chaos, which was clearly a marked feature of his first term, has been weaponized for this term. We will throw so many things out, keep people so much off guard, throw out pronouncements every day of what's coming up, even though they don't come up or they're 180 degrees different than previously. It's kept his opponents off balance. And then the other feature you also mentioned is delegating. If you grow up in a really rich household and you can have people, when he credits himself with being the great deal maker at the heart of the deal, who crafted his legal document? It's the lawyers who wrote the agreements that made sure that every time his business has failed, he gets lots of money and everyone else gets burned. He didn't do that. He brags of never having changed a diaper. How many men in society today who are fathers can claim that? He's had lots of money and he's been able to delegate successfully enough of his executive functions to other people. I mean, if exposés from members of his own party, members of his own cabinet showed how much disarray and how much wouldn't have gotten accomplished, or how many disastrous things were averted by people, pulling papers from the last minute from his, he had a whole suite of people performing executive functions to help him succeed. And
Yeah,
whether or not, he's achieved a level of success in America that's at the top levels. So ADHD
right.
creates barriers, but there's lawyers, there's architects, there's doctors with ADHD who they either had other strengths or had money and ways to get their executive functions taken care of, that they're able to succeed.
Right. And this kind of brings me to the point around at least what I've noticed within successful people or people that win is they have cards that they're dealt with, whether they're good or bad from a societal perspective, but they figure out a way to have an advantage with that. And you mentioned, we talked about entrepreneurs, you talked about Donald Trump. What are some careers or some paths in life that people with ADHD should lean towards, should explore more heavily because of the fact that they have ADHD, where ADHD may not hinder them, it might actually be an advantage?
Yeah, I think, and forgive me for emphasizing too much Donald Trump. I and Huberman asked me the same question. I sort of push back against it because I think it's so individualized. Again, what's interesting or important to you. And if we look back at when Hillary spent her whole life thinking of being president, probably. I mean, maybe the first years, was out of reach for women, and took a methodical every step along the way to advance her career. Trump was interested in real estate and then airplanes and reality shows, and he didn't plan this. There's good evidence he wasn't even thinking about this seriously, even when he, won the election, that he wasn't prepared for it. So again, you would have said on paper, presidency, no, everyone else who made it there had put in all the work along the way, had either a career in politics or a career in the military or even success in business that was more clear cut than what Trump had achieved. He didn't follow that. And again, whether or not he's doing a good job, we don't need to get into, but he's just achieving that level. He's succeeded by some standard. So I think paying more attention to what's really interesting and compelling to you as an individual is more important than saying, oh, you can't be an architect. Oh, you can't be a doctor. Oh, you can't be a this or that. Because I think even though society sets up a way to compete, complete certain tasks or to credential people to get to certain places, there's almost always ways around it. There's almost always ways if that's blocked, oh, well, you can go this way around it and you can become president. Or
Right. I guess the idea also is that if you are interested, whether you have ADHD or not, you have the ability to be hyper focused. Like if you're into
yeah,
video
and
games,
you're enjoying
that's
what
what
you're
you're going to be
doing.
into.
Plus, presumably.
Yeah. And then in the idea of being a spectrum, we talked about how if you have certain tendencies to have cancer, let's say, or have certain diseases from an epigenetics perspective, certain lifestyle interventions or certain lifestyles that you're living, diet, exercise, all these things, these will either trigger those epigenetics to be activated and increase the chances of you getting cancer or that disease and not. You mentioned ADHD is similar in that aspect because it's a spectrum. What are some of these lifestyle uh, habits or interventions that people should really hone towards so that they can make sure that the severity of the ADHD is minimized?
Yeah, number one, far and away, and I know there's people who push diets and push other things, it's sleep. Sleep is so. What's one of the best ways to mimic ADHD symptoms? What is one of the best ways to momentarily impair your prefrontal cortex? It's sleep deprivation. Don't spend all night cramming for your exam. Getting a good night's sleep is going to put you in a better stead. So, all the sustained attention, concentration, working memory, impulsivity, emotional control all get shot to hell by simple sleep deprivation. And there's good genetic evidence that people with ADHD are predisposed to being night owls, predisposed to staying up late, predisposed to not just later hours, but less consistent hours. And one of the biggest findings from sleep, I mean, we've known some of my PhD work was on circadian rhythms, so this is one of my pet issues, but you hear public service announcements for decades. Get your 8 hours of sleep. Most people need about 8 hours. Get enough, get the duration, get enough. And there's so little emphasis on the quality of sleep. And the biggest factor behind the quality of sleep is when you're getting it. Because the same 8 hours, if you're used to sleeping, let's say midnight to 8 a.m., and you stay up on the weekend from 4 a.m. and sleep until noon, you think, aha, I still got my 8 hours. But when you wake up, your brain isn't in the same state. And it's some of the work by Mark Majan Nettergaard at the University of Rochester on the glymphatic system, the brain, the dishwasher of the brain flushing out the toxins. That system is only occurring during sleep. It's actually only occurring during slow wave deep sleep, but it's only occurring during slow wave deep sleep that's occurring at hours that you would normally be sleeping. So there's a circadian factor. So your brain is not flushing out garbage as well. I mean, is that all of explaining what's going on in the prefrontal cortex? We don't know. But getting good regular sleep is the number one factor. And it's particularly hard and challenging for ADHD. And it's an area where medications can actually help with that. If you're sort of more alert and focused during the daytime, it's easier to shut off late at night. But there's a host of sort of behavioral approaches. And the biggest one is just sort of getting buy-in or acceptance, because lots of people say, and there are, again, the genetic propensity towards a late bedtime is also correlated with when you're an evening person. Your brain is really more effective or firing better late in the day. So it's like, here I am, folks. You're not going to tell me to stop. I'm on a roll right now. But if the roll goes on till 3 or 4 a.m. and disrupts the next day, that's counterproductive.
Got it. What are some other lifestyle factors?
Exercise is a huge one. So when I talk about scheduling, so scheduling is a really important tool, probably for anyone who wants to succeed, but particularly for ADHD, because it's what your brain's hard to do. I say there's 4 big things that should go on the schedule before you do anything with work or tasks or others. So the big 4: sleep, meals. And I think what's important there is consistency. There is some evidence that that people with ADHD have more junk food in their diets, and the people who eat more junk food are more likely to wind up with ADHD symptoms. intensive research, some kids are probably sensitive to some of the food dyes and some of the additives, but in general, ADHD is not primarily caused by bad food or sugar. That's another misconception. But a healthy fueling our brain on a regular way. So the lots of people fast, lots of people have diets, but the only adults who ever come into my office and during a session will say, "Oh my God, yesterday it was 4 o'clock and I realized I hadn't eaten all day." That's a tip off. That's someone with ADHD because probably awareness of own body cycles and inattentiveness to certain things and having less regular rhythms is part of it. And if you want your brain to work, you need to feed your brain. You need rest. You need physical activity. So hyperfocus may be fun, but if you're locked in for 17 hours sitting there and peeing into your Gatorade bottle, that's not healthy for your body or your brain. So some amount of regular just movement, getting up, walking around, but also some amount of exercise. And there's a number of studies that exercise can have both acute effects. So someone who's had a workout, within 20 minutes at the end of the workout, we can see measurable improvement in executive functions of the brain. We can also see a longer, people who are physically healthier have physically healthier brains. So, and then having some amount of downtime, rest time, break time, meditation. I think I'm mixing in a couple of different things there. But for simplicity, I put it all in sort of one hat that, not expecting someone to be productive with anything during all their waking hours is, I mean, that's not sustainable for an ADD brain or a non-ADD brain. So
Got it. Got it. Has there been any research on marijuana use and how it could calm? For some people, it kind of calms the nervous system and kind of allows them to just chill out and not have constant thoughts. Some people it does the opposite. It obviously causes paranoia, but for some others, it just allows them to shut down and chill. Are there any research on that?
yeah, so I have a YouTube channel where I have more than 200 videos on different aspects of ADHD, and I jump into the research for each one. And it's the one topic that I've actually changed your mind. So what I saw clinically for years, and this is more in the depression range, is people, this was in the decades before marijuana was legal anywhere. Use was still pretty high in the Bay Area, and people were convinced it's helping my depression, it's helping my anxiety. And what I would see among the people who would quit, and I had one exception in 20 years, but dozens of others would say, wow, I'm thinking more clearly, I have more energy, I'm more motivated to do things. And we know there is good empirical evidence that everyday use of marijuana decreases motivation, makes thoughts less organized, decreases energy. You would think this is a horrible match for ADHD. It's exactly what you don't want. And yet, I did have some people who were saying, yeah, the stimulants helped, or guanfacine helped, or this or that helped, but marijuana is the best thing for clearing the clutter, helping me focus. And the research, it's a small number of studies. Some of them are sponsored by institutes that promote marijuana use, so there may be some bias, but there is some evidence that a subset of people with ADHD really are less distracted, are more able to focus with marijuana. It's probably CBD is probably better, safer than the THC, which the THC is the component that has a risk for psychosis. So I don't recommend it outright to everyone, but I am more open to people who are convinced that it's working for them and trying to help set up how can we test whether this is really doing what you want. And particularly with marijuana being highly fat soluble and components of it lasting in the brain a fairly long time, how do we examine not just the acute effects, minutes, hours after smoking or consuming otherwise, but its longer term effects? And the evidence is still compelling that smoking anything is bad for your lungs and heart and other parts of your body. So probably gummies or edibles are at least removing one source of toxicity in the body and maybe getting a more consistent dose. I mean, there have been numerous studies looking at states which Colorado, others have been at sort of the vanguard of trying to regulate this industry. But even in those states, majority of products, the contents THC and CBD wise are not consistent with what's on the label. So what I would say there is, be cautious, try to observe what its effects are on you if you use it, and be aware that 2 milligrams of CBD from manufacturer X may be different than Joe Blow's blow down the road. So stick with the brand that works for you if you think it's working.
Right. And obviously, this is temporary. Like it's just during the moments that you're feeling those sensations that you have less tendencies to, to have ADHD characteristics. It's not like if you stop smoking or if you stop
Yeah,
taking
and with our
edibles that,
and that's been a complaint. And there's a recent New York Times article, and one of its sort of charges was, if the stimulants work, why do people need to keep using them for years? I mean, and the answer that you're getting at is because they're providing symptomatic relief. They're not changing the underlying process of the condition. But we don't fault a diabetic. It's you've been on insulin 2 years. Isn't it time to get off of that? No, no, because we know it's not changing the underlying process. It's treating the symptoms or helping regulate what's going on. But it can do it powerfully. So, getting back to those dangerous aspects of ADHD, there are numerous studies that for kids or adults who are on ADHD, rates of accidents go down, rates of suicide go down, rates of all sorts of bad outcomes are decreased by people who are taking stimulants or other medications to help their ADHD.
beautiful. Well, John, to close it off here, people that are listening that may have a family member, friend that has ADHD or themselves that's been diagnosed with ADHD or has symptoms of ADHD, what's the final message that we can share that can be an actionable step that can take to help find some relief?
Yeah, well, what I'll say is that the first actionable step is only a half step. So there are dozens and dozens of online surveys where you can take that you can be told whether you have ADHD. And those are screening tools. So they're useful for highlighting who may need further evaluation and help. They are not definitive tests. Most of them are most of them are about 18 questions based on each of the 18 symptoms. But that will not deliver you an answer. The answer still today has to be an evaluation by a trained professional. And a trained professional is probably also the best source as a pathway either to medications, which help many people, or to the behavioral and other approaches, which also can help. And the behavioral approaches, even though a lot of it's common sense, because of an individual's very ADHD-ness, almost always require working with a professional to stick with them. So I have patients who came to me and they have a library full of self-help books for ADHD. And they say, I page through that was a really good idea. I should try that one. And they'll do it for a day or two and then they'll forget it. And they'll say, oh, I'm already doing that one. And it doesn't go anywhere. Because again, it's just being consistently inconsistent is a hallmark of ADHD. And a therapist or a coach or psychiatrist can help provide some of the structure to help someone make progress with dealing with this.
Beautiful. Dr. John Kruse, appreciate you. Where can people find you online before we head off?
So I have a YouTube channel under Dr. John Kruse, where I post weekly new videos on information. I'm on Reddit and the subreddit, Dr. John Kruse, and I'm a better writer than a speaker, I think, on medium.com. So I have more than 300 mental health articles there.
Beautiful. John, thank you so much.
Thanks. I enjoyed the opportunity.